All new at 5. Pregnant teens are expected to make medical decisions for their unborn children. But in Ohio, they're not allowed to make those decisions for themselves.
And Frank, that is because state law forbids teenage mothers from consenting to their own health care. And that includes requesting an epidural during childbirth. Today, News 5's Mona Kozar-Abdi spoke with the people trying to change that. And Mona, this battle started when a 15-year-old asked for an epidural.
Frank and Danita, I'm told the teen was in a great deal of pain and wanted some sort of relief. But without parental consent, the hospital's hands were tied.
It was 2011.
At that point, I was working in labor and delivery in one of the area hospitals.
And nurse practitioner Maureen Sweeney can still clearly recall meeting the teen that would lead her on a 6-year journey.
She was a runaway. She had no family with her. She was staying on the streets and between friends' houses.
Sweeney says the teen had minimal prenatal care. And as her labor pains worsened, she requested an epidural.
I went to go talk to anesthesia about it. They said that she couldn't consent to it because she was a minor.
Sweeney says that wasn't an option for the teen. And at 3:30 in the morning, she couldn't reach a social services worker.
Like, you could see her going through it alone. She couldn't turn to us for help because of that, and that was really sad.
In Ohio, where the teen pregnancy rate is above the national average, this wasn't the only example of the painful gap in coverage that Sweeney had. But it was the one that led her to contact State Representative Nikki Antonio.
I knew that this issue really deserved and required our attention. So we began to develop legislation.
Co-sponsored by Representative Kristen Boggs, the two lawmakers will introduce House Bill 302 next session.
So the bill charts access to health care when the young woman is pregnant, all the way through labor and delivery, and then postnatal.
And Representative Antonio tells me that this bill has received the support of both pro-life and pro-choice groups, and she anticipates it will receive bipartisan support in the state legislature. Danita?